palms are sweaty, knees weak, arms heavy. The first bell goes off. You flip the stem over. Ben is a 7-year-old boy. Please do a cardiovascular examination on him. Then the second bell goes off. You step into the room. The kid's there, swinging his legs over the side of the bed, smiling. You say hi, and your mind goes blank. Hands or pulses first. Did I skip the JVP? Did I check the apex beat? You rush, forget half the steps, and when you finally get to auscultation, you're not even sure what murmur you're hearing. The examiner watches, expression unreadable. You look at your timer, 2 minutes to go, and the panic sets in. If this sounds like your worst nightmare, you're not alone. For the RACP short case, you need to examine a patient, elicit signs, put together a reasonable list of differential diagnoses, and work out an investigation and management plan. That's sort of what we have to do all day, every day as a doctor. And yet, most of us feel totally unprepared for the exam. But what if I told you that there's a way to approach them and all clinical examinations with confidence and clarity? That's why I came up with the drill, distill and deliver method. Hi everyone, my name's Freya and I'm a doctor working in Melbourne, Australia. 2 years ago, I sat the RACP Clinical Exam, and I'll be real with you, I was wrecked. The written exam was only a month earlier, and I'd already used up every ounce of energy and motivation I had to get through that. So the clinical exam rolls around. I'd go into the hospital on my days off trying to hunt for patients with clinical signs, because that's what we need to do to prepare, right? But 4 hours later, maybe 2 kids have said yes, so I'd be left feeling like I'd wasted a day of study. I'd be even more stressed than when I started, and I'd feel guilty for disturbing the patients and their families. Both parties would feel awkward that they'd had to say no to me examining the child, because they were completely over dozens of junior doctors traipsing through their room to try and elicit clinical signs that their child might have. I felt awkward, drained, and like I was wasting precious time on low-yield activities. But what I learned was that the clinical exam doesn't reward those who work hardest, it rewards those who work smartest. So I stopped trying to do things the traditional way. Instead, I broke my prep down into 3 principles: drill, distill, deliver. Drill your exams until they're automatic. Distill your knowledge into fast, high-yield reviews, and deliver confidently by simulating exam conditions. So in today's video, I'm going to share my 3-part method to how I got through my clinical exam with at least a little bit of my sanity left. So part 1, drill, practice until it's muscle memory. You need to practice the exam sequences until they're automatic. There's no point chasing murmurs if you've not performed a full cardiac exam since medical school. Get fluent first. Forget about needing real patients for this part of your study. You just need the reps. I practiced on my husband, my friends, my dogs, my pillow. The goal is fluency. You don't want to be thinking about what comes next in the sequence on the day of your exam. You want to have all your cognitive load directed at finding those clinical signs and then being able to synthesize on the fly. Once you're ready to practice on real patients, you don't have to go straight to the cardiac patient for a cardiac exam. In fact, I'd actually suggest starting with either healthy patients with no clinical signs or patients that you might be seeing for another reason. Then, once you feel like you've gotten on top of that, sure, keep an ear out for patients with real signs. If there's a kid with a murmur on the ward, sure, go have a listen to their chest. But don't spend hours and hours searching for patients with signs when there's not one that's readily available. Worst case, there are so many amazing resources available. So, for example, I got some murmur audio clips off. I think I got them off Up to Date, and it was just the sound of various murmurs caused by various cardiac anomalies. And I downloaded the audio and put them on an Anki flashcard, and then I'd test myself that way. And I would learn how to describe the murmur, what my differentials would be if I heard it on various spots. And I think that was actually far higher yield than finding one patient with a VSD on the ward that I could identify the murmur of, because you've got the spaced repetition with flashcards. We're told we need to see real patients with real signs for our short case exam practice. But the reality is you'll waste so much time looking for one patient and getting nowhere. So get slick with your examinations, practice on healthy patients, and then you can go practicing on patients that might actually have signs you can elicit. But actually, I think that's the lowest yield part of the whole endeavour. The second part of my 3-part method is Distill. And this is how you distill your knowledge in high yield, low effort study. This is where a lot of people waste a lot of time. Reading textbooks, sitting in on clinics, waiting for a patient to maybe come that might have a clinical sign. Finding a clinical sign is part of the RACP exam marking rubric, but only part of one criteria. You can definitely pass a short case without necessarily getting the right diagnosis. Plus, if you are drilling in your examinations, you'll find the signs. And do you know what's worth twice as many points as literally doing the examination itself perfectly? Having a list of sensible differentials and being able to suggest and interpret appropriate investigations related to the differentials. And yes, I made a flashcard of the marking criteria. So to distill the knowledge in the most effective way, use flashcards to memorize differentials, investigations, and complications. Flashcards use spaced repetition, one of the most evidence-based learning strategies, especially for retaining large volumes of information in a short time. I have an entire video on my favourite study hacks backed by science that goes into this in more detail. For example, a flashcard, differentials for cafe au lait macules, so you can reel these off in your sleep, or ptosis, or precocious puberty. Have lists of investigations that you would order in certain clinical situations. So, what investigations would you order if you found hypertension during the examination? And finally, bonus points, and to seem even more slick, have a list of complications of certain situations that you can examine for if you have time, or at least impress the examiners by reeling them off. For example, if a child has achondroplasia, you plot their head circumference and do an eye exam if there's any concerns for hydrocephalus. Check for conductive hearing loss using Weber and Rinne test. And on this, I'll make a note that if you can, leverage other people's resources. I go on about this all the time. I've mentioned it in my last video as well. There's not much time between the written exam and the clinical exam if you sit them both in a row, especially if you're doing peds, because we sit the written exam on the same day as adults, but we actually start our clinical exams a month or so earlier. So see if you can avoid reinventing the wheel. Use existing flashcard collections. I have heaps that I gave out to people that I think now do the rounds from year to year, and at least use that as a base, and then you can add to it with your own flashcards as you go. And finally, deliver confidently by simulating pressure. This part is critical, and this is the hard part, so you've got to push yourself to do it. The clinical exam is performative. You've got to dance the dance. You've got to stay calm under pressure, and you can only do that if you A, drill your examinations, but also B, you've got to get comfortable with being uncomfortable, so to speak. That's why public cases, for example, are gold. The stress of performing in front of consultants and peers forces you to get serious. I didn't really start prepping until I had my first public case lined up, and then I frantically started studying the week before that. The external accountability and fear of public humiliation is a powerful motivator, and it was the kick up the bum I needed. So sign up. Where I trained, you only get maybe one public case because there's so many of us, but you can easily simulate the pressure and learn to deliver regardless. So 1, do every case under exam conditions. Time yourself. Have someone watching and critiquing. Present afterwards and have someone grill you and ask you questions. Do cases with people that you're not close with and that you're not that comfortable with, and you might be a bit embarrassed to flop in front of. That's how you're going to feel on the day, times 100, so get used to it. And if you're doing a practice case with someone, invite your peers along. It's helpful for them because they get to see someone do the case and see them get feedback, but it's really helpful for you because it just adds that level of stress. So short cases aren't just about spotting the signs, they're about executing under pressure. And that's totally different to textbook knowledge, and that's why a lot of us really struggle, because we're good at the textbook knowledge, we're not necessarily good at doing the dance that we need to be able to do to get through these exams. So the short cases can feel brutal at first. There's so much to remember, and the pressure is intense. But here's the thing, they are actually reasonably predictable, despite all the potential variables on the day. So, the next time that second bell goes off and you're ready to step into the room with sweaty palms and a racing heart, remember, you've drilled the sequence, distilled the knowledge, and you know how to deliver under pressure. If you want to take this further, I've made a few free resources you can download in the description. A drill, distill, deliver infographic, a clinical case tracker to help you stay on track. You'll find these in the description below. Let me know in the comments, what's the one short case you're dreading the most, or an aspect of exam study that you're dreading the most? I'll break it down into a future video. And if you found this helpful, hit like and subscribe for more no fluff, evidence-based study techniques. You've got this, let's get it done, but smart, not hard.